Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome to Smile Sisters, and today we're going to talk about different types of composites. Now, first of all, what is a composite? What is it used for? So composites are a material. They come in a paste or a liquid form, and we use them to do white fillings. The types of fillings that you would go to your dentist to get done, you know, if you have a cavity, instead of, let's say, a silver filling or an amalgam. Right. It's an option for that. So it's like the type of filling material that you get when you switch like your silver fillings to white. It's a composite that they switch it to. It's an option. So we have different options for restoring or putting back the tooth structure that you're missing after, let's say, you break your tooth or you get a cavity or something like that. Yeah. So you can get porcelain. That's like a porcelain crown or a porcelain veneer. You can get gold. Right. You can get a combination of metal with porcelain on top of it. And then you can get different types of fillings, which can be made out of gold as well. They can be made out of silver, which is really amalgam, right? Not actually a silver, or this white filling material that we call composite. Okay, and that's very common. That's a very common material that's used. Yeah, it sure is. But it's also a newer material, right? Compared to the silver. Like amalgam or gold, which was like the standard. Yeah. Okay, so what else do you use it for though, other than fillings? Yeah, so when we do cosmetic work, we can use filling material to layer over the surface of the teeth. Right. And that is often called bonding or composite veneers or resin veneers. They all mean the same thing. It means that instead of putting like porcelain veneers over your teeth, the material that we use is composite filling material. Right. And so, yeah, bonding, I think, is like a common term. Like when you chip something, like, can I get a bonding? That's right. Right. A lot of people call it bonding. Right. So tell me about the different types of materials that we can use for this bonding purpose. Right. So when you go somewhere, you might be quoted a huge range of fees for bonding, you know. Right. And the reason for that is there is different levels of expertise and different types of materials that can be used. Right. And so the amount of time that's taken to do this work sort of dictates what your provider, your dentist, will charge for it. And when it takes more time and they use higher quality materials, because there are composites that are lower quality and ones that are higher quality, right? Then the fee might be very different. So you're not always comparing apples to apples when you are looking at fees for bonding, when you're trying to sort of price shop. So one thing that I think a lot of people confuse is, like, let's say you chip a corner of your tooth and then you go into the office and they do a bonding, but they just repair that corner. They just add it back. And a lot of times you can see that line of where your tooth ends and the bonding starts. That's like one type of bonding. But then what we're talking about is when you're covering the entire tooth and you're kind of creating a whole new like layer of tooth structure. Totally, you're right. So you can just replace a missing piece of tooth, or you can sort of reshape the entire tooth, right? Which is really a composite veneer. Right. Bonding for the sake of like veneering the surface of your tooth. Like covering the whole thing. Yeah. Can be really different. And the fees for those two different types of procedures are very different, because repairing just the corner of your tooth is more considered like a filling or just a repair, and insurance typically covers that. Whereas covering the entire surface of your tooth is more considered a cosmetic procedure, and insurance typically does not cover that. That's true. So you can consider the second thing that you said, covering the whole surface of the tooth, like a smile makeover. You're really doing a redesign. Right. So you still design it, try and get the right shape, figure out what's going to look right. So you're really making a change in that way. versus just repairing a chipped corner. You're just trying to match the existing, which can also be very difficult to do.
That's actually harder, I think. That's harder to do than covering the whole tooth in a way.
It can be, because getting that color match can be difficult. And then putting a piece of filling in a corner that's going to last, that's not going to break off, is also something very difficult. And one of the reasons I see a lot of patients coming in with previous bonding that has chipped off.
Right. That happens a lot. And also, I've also seen people who've had the bonding redone multiple times, but you can still see the line. You can still see the difference in where the tooth and the bonding, like they don't blend at all.
And that's where the different range in fees can come in.
Right.
You know, whether you're doing a repair of a corner or you're resurfacing a whole tooth, they're different things, but they still require a lot of skill and often higher quality composites. So two of the main issues that I see patients for revision, so patients who've had bonding done in the past,
Right.
and then and I see a lot of those patients coming in and saying, I don't like this bonding. So the 1 and 2 biggest complaints are that it's chipping off,
Right.
and that it's stained and their gum lines are inflamed.
Right.
And so the first one, the chipping off, often has to do with the way that the bite is. So when you're going to do bonding over your teeth, you have to make sure that your lower teeth are going to be hitting that upper set of teeth sort of in a balanced fashion. If you have some crooked lower teeth and one is kind of pointy and hitting the edge of your upper tooth, then your bonding is more likely to break off. Every time you bite down, there's this like point of pressure against your tooth,
Right.
and then it'll chip off.
Now, we've talked about this a lot, about everything works together, and if your bite is off, your crowns are going to keep coming off, or your bonding's going to chip. Like, everything has to work together as a whole system rather than just focusing on one chipped corner of one tooth, because that's what typically we see is like, oh, this one chipped, fix this one. But why did it chip? Because the bite, and, you know, so it kind of like goes
Together.
all together.
Yeah, sure. So figuring out the cause of the problem,
Right.
major issue. If you're chipping off your own natural tooth and then you just repair that with a piece of filling,
Right. It's not going to be any better.
it's going to chip that off as well. So you have to
But
address
talk
it.
about the different types of bonding. That's what we want to talk about.
So yeah, so the second complaint other than chipping is that the old bonding that they have is staining and pitting. And that has to do with material choice. So there are lots of different composites on the market, right? And some of them are meant for resurfacing front teeth, and some of them are meant for, you know, restoring the back teeth,
Right.
right? And this
Let's talk about why and how are these made.
Right. So composites are basically made up of a bunch of little solid particles suspended in a more liquidy form.
Right.
And the size of those little particles has to do with the polishability of the filling
And the strength.
and the strength of it as
Right.
well. Yeah. So when the size of those particles is larger, then the material is stronger. So you have composites that are macro filled, we call them, and
Yeah.
those are usually placed in the back teeth
For occlusion.
for occlusion. Yeah, because when you bite on them, you would want to have something super strong so it doesn't chip off or break in the
So
back.
think about it. I guess the way I think about it is always in food analogies. Like if you have Jell-O filled with a bunch of chocolate chip pieces,
Right.
those chocolate chip pieces can be little shavings, or they can be like the whole chunky bars. And the bigger those pieces are, the stronger your whole Jell-O matrix, but it'll be harder to polish it and make it look smooth because they're so chunky.
Right.
Whereas if you have the little shavings and the whole Jell-O is filled with these shavings, it's much easier to get a more uniform
Yes.
outcome. Anyways, I hope that's helpful.
That's super
I always think about Jell-O, M&Ms, everything chocolate.
Yeah, so polishability is a major
Yes.
factor when putting bonding on your front teeth, right?
Yes.
Because why does something stain? Often because it wasn't polished well enough, or the material is not polishable well enough.
Right.
And when you have bigger chunks of chocolate inside of your matrix,
Right.
what happens is when you polish it, some of those pieces break off, right? And they leave little indentations.
That's right.
So if you have bigger chunks, you have bigger indentations, and those indentations will tend to catch more staining, right? When you have a microfilled composite, when you have the mini chocolate chips inside of your matrix, and you polish that and some of those come off, you get very small indentations, and so less likely to stain. So you want to use a composite that is microfilled when restoring the front surfaces of the teeth.
And you want one that has bigger, chunky pieces when you're working on the back teeth where you're biting, because that'll provide more strength.
Yeah. And so that is why there is such a disparity in price point when you're going around shopping for doing bonding on your front teeth.
Yeah.
Now, in our practice, we use a combination of the macrofilled or the big chocolate chunks and the microfilled on the front teeth. And the way we do this is we put the macrofilled on the inside right here, right? Let's say you have really short teeth and you're trying to lengthen them, right? So that you show more teeth in your smile, which is something we do often when we do smile makeovers.
Yes.
Now, when you bite down, the back part of your tooth needs to be strong, right? So what we do is we layer the macrofill on the back side of the tooth, right?
So where you would bite.
Where you would bite.
Right.
So we have the strength, and then we layer the microfill on the surface where we want it to be very polishable so it doesn't stain and it stays nice and glossy looking for a really long time.
Right.
And so we're using different layers even of different types of composites just within that. And this is just for structural strength. We also layer for the sake of it looking natural, right? So different translucencies.
I guess that's the next thing is when you chip a corner and you have, you get it bonded and then you always see that line. Well, that has to do with the layering because the person that did it didn't take the time to put different layer composites on, which would mimic the different layers of the teeth and the way the light hits your tooth and it'll like penetrate the first layer, but if it hits the composite, it's just opaque. So then you can see that disparity.
Totally, yeah. So yeah, and that's a big problem when you add little corners.
Yes, it
is.
is.
See light through it in a different way. That light shines through your own too.
Right. And the layering helps with that, right?
The layering really helps. So the bottom edges of our teeth are more translucent, so more light goes through. Right?
Yeah.
So they're not so opaque. So when we're restoring just the edges of the teeth, we have to give the illusion of translucency. So often that very first back layer is made out of almost a clear composite.
Right.
It's totally see-through. And we put a thin layer back there, and then we layer sort of more opaque or pieces of composite that light doesn't shine through as much over the surface in different layers, right, to mimic sort of the same, characteristics that your normal tooth has.
Yeah. So by the end, I mean, we've normally ended up doing at least 3 layers. Plus, you can even do stains to like kind of mimic the different discolorations or colorations of natural teeth.
Yeah.
To make it look like really, really natural.
Yeah. So a bonding or even an edge filling like that where we're restoring the edge is usually made up of 3 layers. Yeah, there's the very back translucent layer. Mm-hmm. Then we add some layers because our teeth are developed in these little blobs of tooth structure called mamelons, and they are more opaque, right? So we add that in, and then you add another layer to sort of filter light through the whole thing as your 3rd layer.
I always love that word, mamelons.
Mamelon.
It's such a good word.
It is a good word, yeah. So...
But yeah, so like to duplicate those mamelons, you add like a 2nd layer, which mimics those mamelons, and then you add a 3rd layer to kind of like give it like the enamel look.
Yeah, right? For sure. And then you can add, like you said, staining. They should take like a tiny little brush, like a paintbrush, really small one. And after that mamelon layer, you can add little bits of stain because our teeth are not the same color.
No,
there is a lot of little inconsistencies between them and different colors between them. So you can really get detailed here. And it's fun and very artistic thing to do.
It is fun. Yeah. And when you see people with those like really white, opaque, like chiclet looking teeth, that's because there's like 0 layering. It's all one blob of composite and it's just like one white layer. So there's none of that nuanced, which makes it look more natural. And some people go for that look. So it's just depending on what you're looking for. But if you want the more natural, nuanced look, you do have to add all these other layers to it.
Totally, yeah. And so the key here, my main job is to figure out what the patient wants.
Yeah.
Like, what is in your mind's eye? What are you looking for? What do you want this to look like? And some people will straight out say, I want to look like I have, I got my teeth done.
Right.
And so that means that they want it to look kind of fake, right?
Yeah.
Because when you get your teeth done and you get bonding or veneers done and they look natural, they can still look beautiful and white and clean and symmetrical. But when they're natural, people can't really tell you got your teeth done. They just think that you look better.
Yeah, they're like, what you do? You got your hair done, your makeup?
Yeah. So I think that's a good thing.
I think that's a good thing too, but you're right. It just depends on what you want as an outcome.
Yeah. So if you are looking for someone to do some composite bonding for you, you really want to look at, has this person done this a lot? What materials are they using? Are they choosing different composite materials to do the front teeth? Do they layer their composites? If you go in, a good way to assess this is if you go in and you want to get 10 bondings done and they say it's only going to take them, 2 hours, then they're not doing 3 different layers with staining.
That takes time.
Layers. It does take a lot of time. Usually 4 to 8 hours. We do it in a couple of sessions.
Multiple sessions.
And multiple sessions to get this done in this way. And you don't have to do it this way. It's more expensive, but it looks natural. It lasts longer. It's more polishable, so it won't stain and pit. So you won't have to get revisions or get it redone as often.
Yeah.
And it's way healthier on your gums. We didn't quite talk about that, but there's also the issue of the gum line. Because you want any bonding that you do to be really smooth at the gum line, not to have a ledge. A ledge can cause bacteria and food trap, give you gum disease over the long term. And taking care of that gum line layer also takes a lot of time.
Yeah, polishing and making it really smooth with the tooth rather than having more of an edge there.
Exactly.
That makes a huge difference in the long term.
And one of the big causes of issues that we see with people that have had bonding done is that their gum lines get really inflamed if that's not taken care of.
Yeah, that's huge. Yeah. Well, I hope that was helpful. And I think you can see the difference in pricing and insurance coverage and just the detail that goes into some of these things. And that's why there's such a wide range of pricing and different things that people see online. So the cheapest price, as with everything, is not always the best.
Ask the right question.
Definitely do your research.
Yeah. Ask them about experience, see photos, before and after photos of the work they've done, and ask them how long it's going to take, what materials do they actually use.
Right.
And those questions will give you an idea.
This is a big investment for most people, so it's worth to put in a little bit of time and research.
Yeah.
Okay, hope that was good. See you next time. Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.